Hi, my name is Rebecca Faino. I'll be doing my presentation on experts speaking on post-traumatic stress disorder. An overview of PTSD, which is post-traumatic stress disorder. It's brought on by a life-threatening event or serious injury where a person is experiencing intense fear or felt hopeless by the event. Some examples can be war, car accident, natural disaster, physical abuse, or even sexual abuse. Now, PTSD has some comorbid conditions that are associated with it, such as agoraphobia, depression, generalized anxiety disorder, obsessive compulsive disorder, panic disorder, social and or a specific phobia, and oftentimes substance abuse and addiction are comorbid conditions with PTSD. It's sometimes difficult to study individuals with PTSD because they have a fear that they'll be looked down upon because they have a mental illness. Sometimes they're afraid that they may lose their job, which everybody at some point is afraid that they're going to do that. But someone with PTSD, they're always worried, they're always afraid, they're always feeling threatened, and it can be very hard for an individual to deal with that. Now, there are 3 stages of recovery from trauma. The central task of the first stage is the establishment of safety, followed by remembrance and mourning, and then reconnection with ordinary life. The individual seeking treatment will receive counseling, they could receive medications and or even attend group sessions to help them understand the disorder and learn what some of the triggers are. A couple of the questions I have are: what forms of treatment works best for PTSD, and does the military offer good treatment plans to help individuals who suffer from PTSD? Now, Dr. Vasterling has received her PhD in psychology at Vanderbilt University in Nashville, Tennessee. She did her internship and postdoctoral fellowship at Boston VA Medical Centers in the neuropsychology department. She specializes in mental health outcomes, neuropsychological, and information processing correlates of PTSD. Dr. Afsoon received her PhD at Kent State University in Ohio. She did her internship at VA Building Sound Healthcare System and is currently on staff at VA since 2007. Afsoon specializes in female clinical psychology. Now, Dr. Vasterling wears many hats. She's chief of psychology at the Boston Healthcare System, where she did her fellowship. She's a clinical investigator for the Behavioral Sciences Division of the National Center for PTSD and is a clinical professor of psychiatry and neurology at Tulane University of Medicine. Her recent work includes a longitudinal study examining the neuropsychological and emotional outcomes of the Iraqi war. This effort is unique. It tracks the mental health of deploying soldiers, starting from the time that they're deployed until the time that they return from Iraq. Below is a listing of a couple websites and some books that Dr. Jennifer Vasterling has published. Dr. Afsoon is currently treating her PTSD patients with prolonged exposure, cognitive behavioral therapy, and the use of Zoloft. She states that we want to understand how threat-relevant information and how traumatic memories themselves are organized in individuals with chronic PTSD. She has the knowledge to help individuals suffering from PTSD with recovery mechanisms and brief interventions after an acute trauma occurs. Studies have shown the use of cognitive behavioral therapy has significantly helped individuals suffering from PTSD. In one case study, there were 6 veterans and their spouses. They were evaluated before the study to determine the severity of the PTSD that they're suffering, and they were evaluated after the study was completed. In all 6 cases, there was a reduction in the severity of symptoms that they had of PTSD. Listed is a couple websites that you can go on to and further read up on some of this. Now, comparing my experts' points of view, Dr. Vasterling finds that the best treatment for PTSD is the combination of CBT and the use of Zoloft. She completes screening before, during, and after the return of soldiers from deployment for the use of research studies. Now, Dr. Afsoon, she uses a PTSD checklist and the Beck Depression Inventory to evaluate her patients to determine the severity of the PTSD and to see if PTSD really does exist in this patient. She directly works with the VA to conduct research studies for perfecting advanced treatments for PTSD. Now, both these doctors obtain the patient's medical and psychiatric history. We both believe in the use of evidence-based practice. And my references, and I want to thank you.